Hey everyone, I just wanted to take a second to introduce myself. My name is Rachel Ibarra, and my topic today is the role of occupational therapy with schizophrenic individuals. Today we're going to be discussing a couple of topics. First, we're going to discuss what is schizophrenia. We're going to talk about the positive and negative symptoms, schizophrenia in our culture. Then we're going to go into the role of occupational therapists with schizophrenia, the interventions and the treatments and settings that an occupational therapist would be involved with an individual with schizophrenia. I am going to go over an OT assessment tool used for adults with schizophrenia, and I'm also going to show you a video from the Canadian Association of Occupational Therapists showing you the way that they handle clients with schizophrenic illnesses. Also, we are going to be going through a crossword puzzle throughout this PowerPoint, so be on the lookout for that. And I hope that you thoroughly enjoy this PowerPoint and get to fully understand the role of occupational therapists with schizophrenia. Thank you very much. Keep an eye out for words that are starred or bolded in this PowerPoint for clues to help you with the crossword puzzle handout that was provided to you. Let's get started. What is schizophrenia? Schizophrenia is a serious mental illness that involves the inability to engage in daily occupations. It is a mental illness that occurs in late adolescence and young adulthood. It's a psychological disorder, and you must have symptoms for 2 weeks in order to receive treatment. It is when individuals cannot separate reality from non-reality, and people with schizophrenia often have hallucinations, delusions, disorganized thinking, and they may hear voices. Schizophrenia is divided into 2 types of symptoms, positive and negative. The positive symptoms include hallucinations, delusions, thought disorder, and movement disorder. Negative symptoms, which are often misdiagnosed for depression, are disruptions to normal emotions, lack of pleasure in everyday life, lack of ability to begin and endure planned activities, poor personal hygiene, and minimal speaking. Individuals with negative and positive symptoms demonstrate impaired cognitive skills, coping skills, communication skills, interaction skills, and they have a difficulty dealing with unexpected demands of the environment. The negative and positive behaviors interfere with one or more major areas of functioning required to live independently in the community. These include your work, interpersonal relationships, and self-care. These symptoms can affect multiple aspects of your life and can run you down. And that's why seeking help is the best option. Next, we're going to discuss schizophrenia in our culture. Schizophrenia today is rarely spoken about. People associate schizophrenic individuals as people who may be violent or unable to make decisions for themselves. Society today has formed a stigma behind many mental illnesses, which hinders that person's ability to feel comfortable in their community. Unfortunately, people have expressed their feelings on mental illness without any prior knowledge. An example of an individual who suffered through mental illness and is still recognized by society for his mathematical mastermind is a man named John Forbes Nash Jr. You may have heard his name before. He was in a movie in 2001 called A Beautiful Mind. This movie was released based on John's life struggles and accomplishments. The main point of the movie is John, the main character, had extreme paranormal schizophrenia and was a senior research mathematician at Princeton University. You are able to watch John live his life with the highs and lows of trying to fulfill his life goals simultaneously with his mental illness, schizophrenia. Although John suffered with mental illness in 1994, he won the Nobel Memorial Prize in Economic Sciences. He is highly recognized in society as a genius, yet he still suffers through mental illness. On the next slide, I'm going to show you a little footage of John Nash speaking about his illness and how it has affected his life today.
The idea that someone who had been mentally ill and impoverished and really on the fringes of society for decades was being considered for a Nobel Prize, I thought that was amazing.
Madness can be an escape. If things are not so good, you maybe want to imagine something better. In madness, I thought I was the most important person in the world. And people like the Pope would be just like enemies who would try to put me down somewhere.
Now we are going to discuss the role in occupational therapy with schizophrenic individuals. Occupational therapists provide services to people with schizophrenia in settings such as acute care, long-term care, and outpatient. You can help improve a client's functions in occupational settings, school, home, leisure time, and work. Occupational therapists work with individuals with schizophrenia to find what important activities they want to accomplish and help them achieve those goals. There have been numerous studies to show that occupational therapy interventions have resulted in positive functional outcomes. These functional outcomes have been the result in helpfully preparing individuals for vocational pursuits. Occupational therapists work with many different types of individuals during mental health assessments, such as psychiatrists, psychologists, nurses, case managers, social workers, and other healthcare professionals. As a team, you can help in the recovery process for individuals with schizophrenia. Next, we are going to discuss the different interventions used by occupational therapists that have patients with schizophrenic disorder. Interventions address deficits in areas of occupation such as failure to organize tasks, hostility and negativity towards coworkers and individuals, misunderstanding of behavior in work settings, activities of daily living, instrumental activities of daily living, work, social participation, and leisure time. Common areas of assessments also include education, motor processing skills, mental and cognitive processing skills, communication and interaction skills, habits, roles, and routines, performance context, activity demands, client factors, and occupational self-assessments. An example I would like to use is if an occupational therapist may assess a client with schizophrenia who is living in a residential hospital. In order to help this individual, they are helping determine the best placement in their community. The assessment may include standardized evaluation tools, individual interviews, and observations to determine the ability to function and live alone safely. Also, they identify important roles and occupations that the individual is able to complete. This information is then used to determine the skills, supports, and environmental modifications the person may need to live as independently as possible. Other examples would be that occupational therapists help individuals with schizophrenia be able to figure out how they would be able to sustain a job. They help them go through the different types of activities they would be able to do during long periods of time and that don't make them feel uncomfortable so that they are able to pursue their life in their work environment. Next, we are going to discuss the different treatments used in the occupational therapy setting for individuals with schizophrenia. Occupational therapists use activities as treatments for individuals with mental illness to try and reverse the inactivity in a mentally impaired individual. Some types of treatments used are cognitive behavioral activities, sensory activities, group therapy, therapeutic activities, life skills training, cognitive rehabilitation, supported employment, supported education, social and interpersonal skills training, life balance interventions, and modalities such as biofeedback and mindfulness enhanced therapy. Therapists use cognitive activities to help memory, cognitive thinking, processing speed, attention span, and logic and reasoning. The types of activities that you would do during these treatments would be puzzles, problem solving, remedial activities, reality orientation activities, and visual and auditory activities. For sensory activities, they are used to stimulate movement, gross and fine coordination, postural balance, and tactical awareness. Some examples of the types of activities you would use during sensory treatments would be jumping, skipping, stair climbing, blindfolding, and feeling grated textures such as rice or beans. And lastly, we're going to discuss group therapy, which is known to help with social participation, group norms, and group cohesiveness. Examples of the types of activities used during group therapy are social skills training, self-care group, stress management, and general awareness group. All of these treatments are vitally important in the overall mental health treatment process. Here I'm going to show you a little video from the Canadian Association of Occupational Therapists and occupational therapist and clinical director of the schizophrenic program, Gordon Hirano, is going to speak a little bit about what they do at his facility and how they work with schizophrenic individuals.
Is based on a recovery-oriented approach. The service we provide is intensive case management, and that includes opportunities for individuals to come here to meet with case managers, some are occupational therapists, in order to gain support with their identified needs. Goals can be supported here on site, or they can be supported at their home or at their workplace, whatever makes most sense for them.
On this side, we're going to be watching another video from Gordon Hirano, the occupational therapist from the Canadian Association of Occupational Therapists. In this video, Gordon is going through a kind of a mock evaluation with this client, he's asking her questions to evaluate what are the best qualities that she has to be able to live independently and achieve the goals that she wishes to achieve with her mental illness.
I want to get a job.
Yeah. And how are you doing with that goal?
I was thinking about kind of work I want to do. Like, I'm not very strong, so there's a lot of like manual work I can't do. Like, can't really shovel sidewalks or anything, and just trying to find out where I want to, like, what would be a good place for me to work.
As an occupational therapist, one of the things that we bring to the program is really that sense of meaningful activity and supporting individuals with improving their functional abilities. Individuals with schizophrenia or schizoaffective disorder can be challenged both cognitively and physically by the illness. So our occupational therapists will support them with specifically goals around independent living, managing to return to work, and really managing their activities of daily living.
Next, we're going to talk about the occupational therapy assessment tool that I chose for this project. The assessment tool that I chose was the Profile of Occupational Engagement in People with Schizophrenia. This assessment tool identifies occupational engagement and translates this knowledge into a profile of occupational engagement. The POES is known for its two parts. Part 1 involves data collection, and Part 2 is the assessment. First, we're going to discuss Part 1. In Part 1, it involves the patient, and they complete one or more diaries within a 24-hour time frame. For each diary, the patient is asked to fill in and provide an account of the use of time during the previous 24 hours regarding any occupation, social and geographical, environment, and personal experience that were possibly evoked that day. The assessor also conducts a supplementary interview. The interview works as a cognitive aid to help the patient recall the chronological order of the events of the experience that evoked that they wrote about in their diaries. In Part 2, the assessment, it consists of 9 items rated on a 4-category ordinal scale. The 9 categories are daily rhythm of activity and rest, variety and range of occupations, place, social environment, social interplay, interpretation, extent of meaningful occupations, routines, initiating performance. An estimation is made by the occupational therapist, and each item may be plotted on a graph to result in the profile of occupational engagement. The higher the score indicates the higher level of occupational engagement that individual has. The sum of the scores indicates the level of engagement. The POES has been shown to have satisfactory content validity and inter-rated agreement, and also internal consistency. Lastly, I would like to go over the answers to the crossword puzzle that I provided for you at the beginning of the presentation. So if you refer to the handout, the role of occupational therapy with schizophrenia crossword, your instructions indicated that you would be reading the clues and completing the crossword puzzle. So I'm going to go through the answers for 1 through 11. For number 1, the clue was poor personal hygiene, and the answer was negative symptoms. Number 2 was OT settings, and that answer was outpatient settings. Number 3 was hallucinations, and the answer to that was positive symptom. Number 4 was the inability to engage in daily occupations, and the answer to that was schizophrenia. Number 5, which goes across, is improve a client's functions, and the answer to that was work. Number 6 was many mental health illnesses have this, And the answer to that was stigma. Number 7 was, the clue was part 2, and the answer to that was the assessment. Number 8, the clue was treatments, and the answer to that was group therapy. Number 9 was patient completion of one or more 24-hour time use diaries, and the answer to that was part 1. And number 10, Nobel Memorial Prize in Economic Sciences, and the answer to that was John Forbes Nash Jr. Number 11, the profile of occupational engagement in people with schizophrenia was the POES. I would just like to thank you for viewing this presentation, and I hope that you enjoyed yourself and was able to learn a little bit about the role of occupational therapy with schizophrenia. Thank you.